طيب جميل. طيب انا سويت شيرنج سكرين عشان يكون بس اسرع بالحركه. لو في شيء قد ما يكون ظاهر لي الشات ممكن احد يشغل المايك. جيد. طيب بدايه هالاسبوع باذن الله بتكون هي بدايه الروماتولوجي ويك، وباذن الله يعني اتمنى انه مفهومكم مختلف ما بين يوم الاحد ويوم الخميس باذن الله. disease you are not يعني familiar with it like cardiology و GI والريسبيراتوري، هذه ممكن يكون عندكم يعني شويه سنس من البيزكس. الروماتولوجي شوي away من الاشياء، لكن باذن الله you will enjoy it and you will understand it very well, because rheumatology, it is not uncommon. Sometimes يعني we need to do more awareness about this kind of disease because the delay of diagnosis يعني even within the physician, primary healthcare physician, family physician, even sometimes internal medicine staff, they are taking time to reach to the proper diagnosis and to think of rheumatic disease. Because rheumatic disease, it is huge, and most of the time it is multi-systemic. It can affect any part in the body. Okay, patient, they might present with cocktail of symptoms and signs. So that's why in rheumatology service you need to have a very thorough history, comprehensive history, and you have to be ready to take a very good history. طيب عندنا تو سيشن الان. we will go just overview على الفيزيكال بارت. ممتاز. ما راح نطول فيه لانه باذن الله كلكم راح يمر عليك البيت سايد، والبيت سايد اصلا عباره عن two things. ف plenty of things will be more clear during the bedside. We will just have an overview today, so things will be more clear in the bedside. Rheumatology، الهاند، ني، بعدهم الباك، بعدهم يجي الشولدر. These are the most important joints that we need to know. Okay, so because these are the most common presenting joints. In your course, you are supposed to master the hand examination and knee examination. So let's start with hand examination. Okay, so first, as you know, introduce yourself and take permission. Wash your hand, ensure privacy, proper position, sitting, and proper exposure. So the position usually sitting on a chair, and proper exposure always has to be one joint above. When we examining in any joint, we have to examine one joint below and one joint above. Okay, so الانسبكشن. طيب احنا نتخيل انه المريض جالس على كرسي و I will ask for pillow. Don't forget to mention it during exam. Ask for pillow, so the patient, he will rest his hand over the pillow. Okay, and then you start inspection. Please do not touch the hands at all during the exam. لأنه أغلبنا يعني دائما أول 30 ثانية بعدها كذا خلاص ينسى روحه، يبدأ يسوي touching everywhere. طيب I like things to be يعني more systematic and organized. So we can start inspection either from the hand pads going up to reach the wrist and then elbow, or vice versa. We can start from wrist going down up to the finger pads. So from the beginning, we will have to look for the finger pads, looking for digital infarction and gangrene. Why do you think that we should care about digital infarction, gangrene, and rheumatic disease? Rheumatic disease, most of the time, you are dealing with young. So why do you think these are important?
As complication of some diseases, for example, vasculitis diseases or vascular diseases.
Excellent. Excellent. Because, yes, excellent. And it's unusual. It is very unusual to have a patient who is a young, middle age. He's not diabetic, not hypertensive, who presenting to you with like blackish finger, or with digital infarction or ulcer. These are commonly in a patient who is prone to have atherosclerosis, elderly with comorbidities. But when you have a young female, young boy who presenting with these things, this is a very important sign. And يعني, when we just look for a blackish finger from يعني مجرد ما تناظر خلاص, you have to act urgently, promptly, quickly, aggressively. So excellent. So vasculitis. What is vasculitis? What do you mean by vasculitis? Any idea about vasculitis?
It's inflammation of the blood vessels due to immune complex deposition, most commonly.
Excellent. So this complex, it will sit over the vessels, which create the inflammatory process, platelet aggregation, and thrombosis. Okay, and sometimes will cause the neurostenosis. Okay, then we go to the nails. Okay, from nails you can reach to very important, sometimes dangerous diseases. Okay, so we can look for pitting. So why we are looking for pitting in nails in rheumatic patients? What do you think? Excellent. This is, it's not an uncommon scenario. Okay, and a patient who presenting to you who is having like a joint knee swelling or DIP swelling. Okay, and most of his lab is normal. So we do the rheumatic disease, rheumatoid antibodies, SLE antibodies. So you will sometimes in dilemma, okay, to read theoretically. So you look for like skin, like an elbow, like around the umbilicus, okay, sometimes in the gluteal area, sometimes over the extensor surface, just to catch some hints. And these hints sometimes is psoriasis. Again, in nails, nail pitting, onycholysis, or yellow spots, these very good signs to reach the diagnosis like psoriatic arthritis. Clubbing. Why you are caring about clubbing and rheumatic disease? What do you think? Yalla, quickly.
SLE can present with clubbing if it affects the heart, for example.
Okay. Maybe more accurate answer. Okay. So clubbing, most of rheumatic disease can affect lung, which is causing interstitial lung disease.